We're here today with Dr. Vince Henderson, the president of Beacon Medical Group. We are here to talk about our new COVID testing unit, a mobile unit that will be hitting the streets in South Bend on Wednesday. So, hi, Dr. Henderson. Tell us a little bit about the objective behind this unit, why we have it available. What is it?
Well, Beacon Health System and Beacon Medical Group are trying to reach out into the community where we see a disproportionate amount of disease. And what we're trying to do is see if there are ways that we can tap into the community and community resources in a different way. What we're proposing that we do at this site is to have a mobile unit attached to or next to Mount Carmel Missionary Baptist Church. We'll be using a drive-through process for patients to come in to that area where we can test them for COVID-19 disease. We will have the mobile unit there for supplies and for a respite for our staff that are doing that work.
So, Dr. Henderson, tell us who this is really geared toward. How should you know if you should be out visiting this unit tomorrow or in the days to come?
Sure. If you've been in contact or have had a loved one, a close contact who has had coronavirus, that is one, you are at higher risk, and we would like to know, you would like to know whether or not you are indeed positive for that disease. If you've traveled to an affected area isn't necessarily abroad now. It could be maybe to an area within New York City even, or in Chicago. And if you have any fever, cough, sore throat, or other respiratory symptoms, then you are at risk for having COVID-19, and we think that you should be tested.
What should patients expect once they arrive at this unit? Because people won't be familiar with it like they would be if they go to the hospital or a med point. How will this be different? What can people expect?
Well, we want to make it convenient, and so we're asking that you stay in your car. You're going to drive up to the facility. We will have our staff go to your car. They will ask you some questions. They'll take some information. We need to know how to get in touch with you once your test results come back. When we identify that you fit the criteria for testing, we'll actually take the test while you're in your car. You don't even have to leave your vehicle. And then after that, you'll leave. We will contact you by your preferred route within a week with the test results.
An amazing opportunity for a lot of people in the community. Are there future sites that are in the works, or what can you tell me about the plans?
Yeah, we are looking at Goodwill has reached out to us and would like to for us to consider some type of mobile unit in that area, as well as in the Napanee area. So we're looking at a potential site in Napanee for this same type of setup.
That sounds great for all the people in those areas as well. Is there anything else that you wanted to mention about what went into the creation of this unit, any of the thinking behind it, and anything else you want people to know?
Sure. I think one of the problems that we have is just the disproportionate disease within the African American community and people of color in general. If you look at New Orleans, 30% of the population are African Americans in New Orleans, but 70% of the COVID-19 deaths are African American. Now, this disease affects everyone. No one is spared the disease. But for those populations in which social distancing is more difficult, or you have a job that requires you to be front-facing with the public on a regular basis, or if you have comorbid conditions such as diabetes or hypertension or obesity, those states, those disease states, those risk factors put you at much higher risk for having death associated with COVID-19. We need to do everything we can to reach out into communities where we find that type of disparate health condition.
This is an important unit to get out into the community, as you just described. So thank you very much for your efforts. And we'll be communicating to the public then where this unit will be traveling to in the future, correct?
Correct. We will let you
Okay.
know, and please stay tuned. We're all in this together.
We are. Dr. Henderson, thank you very much.
Thank you.